does the doctor say in this report Sushant was on, and that he was clinically depressed, and that doctors felt that he could take an extreme step unless he went back on his medicines immediately. Tell us all that you know from this report.
You know, Rahul, most importantly, Dr. Kasi Chawda in his medical report clearly mentions that when he met Sushant for the first time at Waterstone Club in 2019, when he got a call from Sushant's manager, he realized, when after meeting him, he realized that he has been suffering this from many years, and he has been going through the treatment also from many years. In fact, Dr. Harish Shetty, whose name Riya was taking, it's confirmed that Harish Shetty has been treating Sushant since 2013 for the same issues, anxiety and existential crisis. And, you know, these are the symptoms which Sushant has been facing quite a long. And if you look at the whole chart, you can see that every month there used to be these panic attacks. Every month there used to be swinging from one pole to other pole, being happy to completely depressed, saying that Mumbai is very claustrophobic. He wants to go somewhere else for his own mental peace. He doesn't want to stay in Mumbai, telling the doctor that how he suffered because of his mother's death and how he feels a void in his life after his mother's death. All these indicates that Sushant was suffering from mental illness, and not from 2019 but from 2013. He must be suffering from that even before that, but we do not have specific confirmation about that. And there are 5 doctors whose statement has been taken, and all the doctors who have treated Sushant all have confirmed that he was suffering from this illness, and he was under medication. In fact, in a few of the chats, Kasi Chawda, who has given this medical report, has also asked him to stop smoking, because he remembers that Sushant asked him that while taking medicines, can he smoke, on which the doctor has told him completely no. So, you know, this indicates the mental status of Sushant Singh Rajput. We do not want to arrive at any kind of conclusion. Let's just go through what this report
says. Hyper-anxiety, depression, existential crisis that could lead to suicide if the patient is off medicines. Now, this is part of the medical report. Now, Sean of medical jargon, just try and explain in layman terms what you've understood so far from this clinical assessment of the mental condition of Sushant Singh Rajput.
So, Rahul, let's be fair here. I think the first thing is that not knowing more details to actually comment specifically is virtually impossible. But I'll break it down for you in a very generic way, because it applies to almost everybody, and so many people listening to you right now need to understand the importance of what I'm saying, because we also need to bring a sensibility to conversations around mental health and bring an insight and awareness, because this is important for the society. One, let's all of us understand we are talking about a medical illness. We need to stop treating mental illnesses as though they are anything else, and stop thinking that they can be faked. Stop thinking that they are individual limitations. They are a matter of choice. All of that is rubbish. They are medical illnesses. Second aspect, let's come to both depression and anxiety. WHO says the world's single largest illness in the world, Rahul, is depression. 300 million people globally suffer from depression. 240 million plus people suffer from anxiety. We are more likely to have depression or anxiety as compared to some of the other illnesses. Now, like any illness, let's take an example of diabetes, thyroid, blood pressure, you name any medical illness. If I am on a treatment, and if I do not comply with the doctor, if I do not take my meds as prescribed, naturally the illness will become worse in me. It's no different whether it's a physical illness of the body or a medical illness of the mind. So yes, if I am depressed, if I have an anxiety disorder, and if I'm on medications, if I don't take them, naturally it won't work. The other component, look at a triangle of what causes mental illness: biopsychosocial, biomedical causes, neurotransmitters. Basically, if you have a psychiatric disorder, you have low chemicals. Second, psychological, which is your personality, your experiences, the way you think. And third, your support system and the triggers around it, which is the environment. What is the treatment? Biological, you give medications to take care of the chemicals. Psychological, you give cognitive behavioral therapy, other forms of therapy. Social, you work with the family, work with the friends, work with the support system to help the individual come out of it. Now, that's how you understand a psychiatric illness, and that's how you look at treatment. And naturally, if during this course somebody's compliance goes up and down, which is not uncommon in psychiatric disorders because sometimes they tend to be either episodic or chronic, that's where you utilize your rapport as a doctor or a therapist to help the patient get more compliant. You use the family support systems, the friend support systems, and improve